So I'll be leading our presentation today, and this work is based on work by myself and my two other co-authors. One is here, Dr. Professor Seidu Sofo, and Dr. Cassandra Loggins, but Dr. Loggins is not here. It's only myself and Dr. Sofo who are here, and I will start with the presentation. And the title of our study or research is Predictive Power of Social Determinants on Access to Medical Care Among Individuals with Diabetes in the United States. And this is the outline of our presentation. We will start with introduction and then give the purpose of the study, talk briefly about the method, and then provide the results, conclusions, and some references. So by way of introduction, diabetes remains a significant public health challenge in the United States, placing a substantial burden on individuals and the healthcare system. Therefore, ensuring access to healthcare is critical in diabetes care. About 10.5% of the population have diabetes, and the economic impact is equally daunting, making diabetes and its related complications accounting for billions in healthcare costs annually. Social determinants such as income and education level have been shown to significantly affect the prevalence and management of diabetes, with lower socioeconomic status linked to higher disease incidence and poorer health outcomes. The purpose of the study. Actually, the study examined the predictive power of social determinants on access to medical care among 2,620 individuals with diabetes in the United States. Therefore, understanding the predictive power of social determinants on access to medical care for individuals with diabetes is crucial for developing targeted interventions and policies. Now, here are the research questions that guided the study. The first one is the first research question is, to what extent do individuals with diabetes delay seeking medical care due to cost? The second question is, how do demographic factors predict individuals with diabetes delaying seeking medical care due to cost? The third question, how does geographic location predict individuals with diabetes delaying seeking medical care due to cost? And the fourth question, the last but not the least, is how does socioeconomic status predict individuals with diabetes, delaying seeking medical care due to cost? So by way of method, in this study, we had 2,620 individuals with diabetes as participants, okay? And the data that we used actually came from the microdata records from the Demographic Health Survey in the Integrated Public Use Microdata Series, and the acronym is IPUMS. And the variables that we studied, we have them in two parts. The response variable, which is delaying seeking medical care due to worry about cost, where we use yes to mean the individual indicated delaying seeking medical care as a result of cost, and no means otherwise. It means it's not yes, okay? And the predictor variables studied include type of diabetes, which we, abbreviated as DIAB type, and then sex, age, region of residence, which we kind of shorten it to region, and employment status, which we use MSTAT as a short form of that. The statistical analysis, we have it in two parts. We have the descriptive statistics, and then that was supplemented with the inferential statistics. So with the descriptive statistics, we use frequencies, percentages, and quartiles, in particular the median. And then the inferential statistics, we use the Pearson's chi-square test, the Wilcoxon's rank sum test, and the binary logistic regression with some slight modification using what we call upsampling. And we use the upsampling because one of the response classes was in a minority. So we try to improve the number of observations in that class. And that is the reason why we use upsampling, just to help get a better results from our analysis. And all significant tests were performed at the 0.05 level of significance. So here are the results. So we first start with table 1. And table 1 has to do with the summary statistics. So with the summary statistics, approximately 6% delayed seeking medical care. And we found that sex and employment status were associated with delaying seeking medical care. However, I will say we also found significant difference in age in terms of delaying seeking medical care. However, diabetes type and region were not associated with delaying seeking medical care. Then we have table 2, and table 2 provides the logistic regression analysis results with upsampling. And that's what we caption here as inferential analysis. And based on the results from the table, we can see that the odds for females delaying seeking medical care are about 51% higher than the odds for males. Also, it can be observed from the table that as age increases by a year, it is expected that the odds of delaying seeking medical care decreases by about 4%. And diabetes type, region, and employment status were not significant predictors of delaying seeking medical care, as shown on table 2. So in conclusion, we will say most of the respondents in this study did not indicate delay seeking medical care due to worry about cost. Sex and age were found to be significant predictors of delaying seeking medical care due to worry about cost. However, diabetes type and region were not associated with delaying seeking medical care. So in terms of predictive power of social determinants on access to medical care among individuals with diabetes in the US, sex and age were key predictors. And here are some of the references that we use in our study. And thank you, and we are open for questions, comments, and suggestions.